everyone, it's Hilary Cragg here. Thank you so much for listening and watching this video, and I really hope it's helpful. I'm recording this at the beginning of May in 2020, which is the time of the global pandemic, the time of lockdown, and for perfectly obvious reasons I'm going to talk about dementia and corona. And I think there are two different levels of issues that are going on with corona. I'm going to talk about the first one that I'm going to talk about is the actual disease itself and how it interacts with dementia. Now, the disease itself, the COVID-19, corona disease, whatever you want to call it, is a disease of the lungs, and it's a viral infection. And what it does is the virus attacks part of the lungs, which then has an impact on how the lungs function. Now, because it's a virus, antibiotics won't help it. It will create a number of symptoms, and that's predominantly obviously to do with breathing, but it can affect other parts of the body. So if it gets into the heart, for example, it can have an impact on the heart, but predominantly it affects the lungs. And the body itself will fight off the virus because at this moment in time there is no cure and no vaccine, so nothing can prevent it. And therefore, if somebody actually gets the corona virus, then it will predominantly have an impact on their lungs. Now, their body's own immune system will fight that virus. And therefore, what the hospitalisations and all the treatments are about is about supporting that person whilst their own immune system fights that virus. Now, people that are fairly well would actually be able to just fight that virus. They probably feel a bit rough, they feel a bit tired, they might have a bit of difficulty breathing. And there could be other symptoms, there might have a bit of temperature. There are some less common symptoms, but trouble breathing, temperature and tiredness are the three very common ones. But that person would be able to fight it off without needing any particular high levels of medical intervention. Now, for some people, that's not enough. And depending where you are in the world, the statistics vary slightly, but it's approximately 20% of all people who get it will have severe enough symptoms to require hospitalisation and some sort of very invasive or medically supported level of support to make them feel better, which will allow their own immune system to fight the condition. And that may include being ventilised, being put on a ventilator. It may include just some oxygen, and obviously they need their fluid supported and those kinds of things as well. And depending where you live in the world, the death rates are running from approximately 1% to about 4% of all people that get it. And obviously those are the people in general who have underlying health conditions, and particularly those people who have underlying lung health conditions. And an awful lot of those people, not exclusively, but an awful lot of those people who have those underlying health conditions would probably die in any event, but they would die from the symptoms and the conditions that are their underlying health conditions. And obviously there is this crossover with those people that would die in any event, but that's not exclusively, and there are extra deaths associated with corona from people who would not have otherwise died. Now, whilst lots of people would be able to predict whether they're in the 80% that they would have mild symptoms, or at least symptoms that wouldn't require hospitalisation, they might be in the 20% that might require hospitalisation, or they might be in that very small percentage that are going to die. People might be able to predict where they might be, but there's always going to be a chance that they're going to be wrong, because they might have an underlying health condition that actually they don't know about. they might just be really, really, really unlucky and not able to fight that virus off. So that's a little bit about the coronavirus itself. And the other thing that I want to talk about is around the anxiety and the fear that's going on at the moment with the restrictions of lockdown and just the fear of going out in the public and the fear of catching a disease. And all of that is as mentally straining, if not more so in some cases, and as difficult to manage as the disease itself. And I just really want to focus on that issue of the idea of the fear and the restrictions of lockdown and the mental anxiety that everybody's going through. Because those are real concerns for people. Lots of people are having a really, really difficult time. Domestic violence has spiked. So if you're forced to live in a home with somebody that you don't actually get on that well with, that's going to make whatever's going on at home so much worse. So anything that's going on inside a family home, anything that's going on inside a relationship, is just going to have this spotlight put onto it. And if it's great, it'll be even more great. And if it's not so great and there are difficulties in it, then those are all going to be amplified. And they're all valid stresses, you know, not being able to go out to your favourite local restaurant, not being able to go out to a coffee shop, not being able to see your family, not being able to see your local groups, not being able to go to work if you still work. All of those are real concerns for those people who are actually quite anxious about those concerns. They are real concerns. Sometimes you just need to kind of take a moment and not catastrophise them, but it doesn't mean that you don't feel them in the first place. And there are lots of self-help videos around the mental health support around Corona, so I'm not going to go into those at this point in time. I'm just flagging up that the anxieties around the risks of lockdown and the restrictions around lockdown are very real, and people are suffering real anxiety around them. And so I wish you well, and I hope that you are able to cope with those. And so then the final thing that I'm going to move on and talk about is how that interacts with people with dementia. Now, dementia is as I've said many times before, it's an impairment of the brain. It's where some cells in the brain have died or are in the process of dying, and they're it's an ongoing deterioration. So the damage in the brain is increasing. And how that affects people with dementia and how Corona is going to affect people with dementia depends on how the brain damage has affected them. Now, if the brain damage, and it would be an unusual presentation that they had as a direct result of their damage in their brain, that they had lung problems, then Corona is going to be a real potential health issue for them. It might be that they've got another underlying condition that isn't directly related to their dementia, such as, so for example, if they had asthma, that's also a lung condition. They might not remember quite as well as somebody who's cognitively able to take their medication to do with their asthma, and so they could be at further risk. And the other thing that they're at risk of is actually just catching it and passing it on, even if they're not directly at massive risk of huge health problems themselves. They could be part of that 80% that just has some condition, that symptoms that they could be able to be nursed at home if they develop Corona. But the way that Corona is prevented is by making sure that you wash your hands all the time. It's passed on through the tiny droplets of moisture that are in your breath. And if anything lands on a surface, then that surface becomes contaminated. And then if people touch that surface with their hands, and then from their hands take it to their face, and then it gets into the body. And it's really contagious. It's really, really easy to catch. And when it's in, that's when obviously all the symptoms will develop. So it could be a problem. It could be a real problem for somebody with a dementia. It could be that actually they're much more likely to catch it. It could be that they're much more likely to pass it on, because even if they didn't know that they developed it, if they had sufficiently mild symptoms that they didn't particularly know that they had it, they wouldn't necessarily think to take the precautions, and they could absolutely pass it on more easily. And the other thing that they're massively at risk of is being taken advantage of some of the scams that are going on at the moment, because they might not have the cognitive ability to understand the risks of being scammed. And there are a whole new range of scams going on at the moment to do with corona. People with dementia are at risk of being scammed, and I'm going to do another video about scams in general. But I just wanted to do this one about corona now. So there are lots of problems going on, problems for everybody, but there are some real specific problems that may affect people with dementia. So if you know somebody with dementia at this point in time, then if you're able to help them in any way, then that's wonderful. Even if you just say hi, loneliness is a real problem, and loneliness is going to get worse during corona. If you check in on them, make sure they're okay, make sure they've got enough food. Obviously staying safe, if you're not part of that household, staying safe at the social distancing. But for all people at this time, it's really difficult, it's really stressful, everybody's having a difficult time. Everybody has good and bad days, and for anybody who gets unwell, I wish you a speedy recovery. So take care and have a great day. Bye.